At this time, I would like to introduce our guests from Alliant Mesero, Wendy Williams and Chuck Lawless and Ryan, who are going to be talking to you. Wendy about our new health benefits program, providing free benefits to everyone. Not really. Just want to see if you're paying attention. And then Chuck is going to talk about 401ks. But Wendy?
Good afternoon. It's still morning, right? 11:15? So how is everything so far? Good? You guys learning a lot? I don't know what the focus is of your meeting, but I've been invited to come and speak to you about some little-known benefits that you have through your employee benefits program. So just a little bit of background. I'll take 2 seconds to talk about myself. But I appreciate you guys inviting me here. I recognize some faces that I've been able to meet through the last couple years that I've been your employee benefits broker. So I handle a team and I handle Lieberman's benefits. So what we're going to talk about today, of course, is getting the most out of those benefits. We are not going through our open enrollment just yet, so there's nothing necessarily that's new going on, but I wanted to take a few minutes to share a few things that you guys might not know about. And it's important because there's a lot of things within your benefits program that are deeper and broader than what appears on the surface. And so I'm going to get started real quick here. Let me tilt this a little. Go. Okay. I don't have a quick agenda. I've got 15 minutes, so I'm going to talk really fast. I don't think we're taking questions, and then I'm going to lead into Chuck and Ryan. So, health and wellness. This is probably something that you guys do know about, but I wanted to take a second and refresh everybody's memories. There are preventive care benefits in all 4 of your health plans. That was due to ACA. They're baked in, built in. You guys should definitely take advantage of them. Women have additional benefits. You know, our list is much longer, and I don't necessarily know why, but they just want to poke and prod us, you know, a little bit more. But coverage is available to you at no cost. There's no copay, and it's not subject to co-insurance. So any mammograms, health screenings for all your children, immunizations, a lot of different screenings, PSA tests for men. Again, well worth your time to make and spend so that we can prevent, you know, emergency room visits on the back end, higher cost, chronic conditions, things like that. So take advantage of it if you can. There's some lifestyle management programs as well that are available to you. Weight management, tobacco cessation. So you can basically talk to the coaches and they can design some programs for you from within Blue Cross, and obviously work with your doctors. Wealth of help if you just reach out. And further in the presentation, I'll let you know exactly where and how to talk to those folks at your leisure. Nurse line. Has anybody ever used the nurse line at all? Are you guys aware of that? Good, I see some head shaking, that's wonderful. Available to you 24/7, and it doesn't cost you anything. So a lot of people use it during the night, you know, a lot of times with kids, that's the most popular reason to use it. But you can ask a nurse, hey, I've got some symptoms, I don't know if I should go to the doctor. You think I can get in, you know, get this done during, you know, an urgent care visit, maybe convenience care. Talk to them, give them a call, it takes 5 minutes. Maybe, you know, you can prevent going to the emergency room and racking up a big bill for yourself. So that's just something that you have available to you. Keep that phone number on your fridge, you know, so that you know where it is at all times. Because that number is not on the back of your ID card.
It's free. That's free.
Yeah, the service is definitely free. So no cost, they're not going to bill your plan. It's just available to you 24/7. So anybody with conditions, if you have a chronic health condition, there's some support available to you. If you have diabetes, you know, heart disease, again, we talk about metabolic syndrome, which is multiple conditions. You know, how do you know, navigate different providers to get to the right one who can help you, you know, interact with most of those physicians? You know, because somebody's handling this specialty, somebody's handling that one. Let's talk to these condition management. So if you ever potentially get a call from Blue Cross, take that call just to say, yes, I think that might be worth my while. Maybe I don't need the service right now. Maybe I might need it in the future. Send me information. You know, it doesn't take a whole long time to basically get a chance to talk to them. But they're there if you need it, and they're there to help. Again, just supporting you as you need. Have you ever gone to the doctor and then you don't? You're so overwhelmed with the diagnosis, and then all of a sudden you say, oh my God, what did he just say? You get in your car and you're like, well, now I can't talk to him because now I've left. And then he doesn't have time to talk to you. Call those folks. They'll be able to help you navigate some of his instructions, give you some better advice now when you've had the time to digest some of it. Special beginnings. Any new expectant mom has support, whether prenatal, postnatal, all the way through, taking care of that child. You can get programs. They can steer you to free services, lower cost services, everything that you might need during the 9 months of pregnancy, which, for most, it feels like a lifetime. So anyway, so Blue Access for Members. So most of the programs with your Blue Cross plan, of course, is going to be online. And if you haven't had a chance to register yet, I would suggest you do so. You can do so many things on this, but here's just a quick overview of what you can do on Blue Access for Members. They call it BAM. Everything in our industry, at least in ours, is an acronym. So I will try not to use them too much, trying to recognize my audience. But under Blue Access for Members, you can do the simple stuff like check your claims and so forth. But it is a gateway to all these additional services that Blue Cross offers. And most importantly, we're going to talk about the nurse line phone numbers there, but who wants to get up online and log in and try to find that phone number, put it back on your fridge. Telemedicine, we're going to talk about what that is in just a few minutes. And I should say one thing. This program, this presentation here, is going to be posted somewhere on your own intranet, so nobody has to take down notes or phone numbers. It will be available to you, shortly after this. So I'm breezing through it pretty quick. Just I want to, again, bring all these highlights up to you guys as part of your program. So signing up, pretty simple. The Blue Cross website, if you haven't gone there already, bcbsil.com. Simple enough. On the right-hand side, register. Doesn't cost to register. It's just obviously recognizing your profile. So you create a password, create an account for yourself, and then you have access to all the information you need. Okay, this is a fun one. I can save you probably about $120 a year. So anybody who's getting, I shouldn't use any names. Off the radio, you hear about identity theft protection for $9.99 a month. You don't need it. If you are a Blue Cross member, you have access to their Protect My ID, identity theft protection at no cost for you and your household members as long as you stay a Blue Cross member. So again, good reason to stay with Blue Cross, save a couple $100. They'll give you credit monitoring, fraud resolution protection in case you are a victim, of course, and then theft insurance if they do steal any money, tap into your 401k money, that kind of stuff. So, and then of course, the credit reports. So again, a good one. You just need to go log in and take advantage of that program. Okay. So online resources, the member wellness portal. Again, another convenient thing. You can take a health risk assessment on there. You look at tracking tools, for health and wellness. If you guys are into doing some initiatives, if you want to, walk, you want to, track your steps, you can do that online. Obviously, there's texting alerts. There's the Blue Points program. You can earn like workout equipment and some other, gift cards and things if you're doing some online. Taking some quizzes and tests so that they know that you're actively trying to improve your lifestyle and your health and well-being. So they do have the discount program. There's exclusive coupons on there from national local retailers, recipes. Again, coupons come in really handy. You can get your gym memberships through there. We're going to talk about that on the next slide. But again, go into Blue Access for Members, and that's where you can tap into these programs. So Well on Target, the fitness program. It's $25 to sign up, $25 a month, and you have access to about 9,500 gyms across the country. And you're not locked into just one gym. So you're traveling, maybe that might be helpful. Maybe you like to, sometimes go during home hours and you want to go one closer to home. Maybe it's closer to work. You have that ability to do so. And one time per year, and I think it's usually around May, they have a program where they waive that sign-up fee, that initial $25. So again, something available to you. It's a little bit more affordable than some of the gyms out there. Fitbits, who likes a Fitbit? If you don't have one yet, they have a new program that is available to you under this program. You get 18% off all their whole line of Fitbit devices, and the shipping is free. So you can, obviously, if you're looking into starting a wellness regimen, talk to the coaches, get your Fitbit, join a gym. Everybody talks about it. If you're not interested, that's up to you. But again, wanted to make sure that you guys are aware of all these programs available. Self-directed programs. So if you're dealing with a new diagnosis, you've got some high blood pressure, if you don't want to start on a medication regimen, maybe you want to go through a self-guided course, take some of these programs. These are new on the website. And then they've got several more that are launching at the beginning of 2019. So just a few, maybe help yourself, maybe help a family member, just giving you more advice from your health company. Okay, Blueprints program, obviously, we talked about earning rewards, redeem them for the shopping, in the shopping cart in the shopping center that they have for a variety of items. Okay. And then, of course, what isn't, the end here? Mobile apps. They've got their mobile app for Blue Access for members that you can, download your ID card. You don't need to carry it with you. You've got your Well on Target application where you can take, health assessment and do a lot of things just online. So see your Blue Point balance, work on some of those during your lunch hours, during the train rides, things like that. And then there's the Health Family app. Again, this is kind of cool because you get a chance to find out what types of preventive checkups are recommended for you and your family members based on your age and gender. So those are there. You can make sure that you can add your historical tests so that you keep maybe more of your medical record within that app. So that, if you have some tests done and you don't know when, you're going through maybe a long, year-long situation, you can keep track of the dates and things that you've done. Set reminders to have your mammogram next year, whatever you need. So that's a tracker that you can, if you guys like to be organized, and that's one part of your life that's, maybe lacking a little bit, this might be something that will be your friend. Okay. Talked about the Blue Cross app. Again, same thing. You can do it on the computer. You can keep it on your phone. View everything you need to do. Okay. Finding a provider. This is one of the most reasons why people call into Blue Cross is to help them find a doctor. Getting a recommendation is good, but you have that ability to do it online. Pretty simple stuff. Go online, find the doctor. You can sort by all sorts of different categories. You can get their quality recommendations and their designations. You can get patient reviews. Did they like that doctor? Did they not? Just like Yelp and so forth. So pretty helpful information, goes pretty deep. Good thing to find. And this is just more searching aspect, another detailed layer here of the same thing. You can also get cost treatment estimator tool on there as well. So for this one that I chose was an MRI. So it will show you, so those folks that are on the high deductible HSA plan, it'll show you what certain facilities are charging for that exact same procedure, and they vary widely across physicians. So, and these hospital locations are very costly. So I wanted to share with you just one tip that might be of help to you. Again, trying to save you money on your back end so that you have more money left over. So those that have the high deductible health plan, most of the MRIs, if you're familiar with that, anybody's had one in the room here, roughly $2,600 on average, going through the hospital system. Your doctor recommends it. You just go on the same campus, go same day, next day. But there is a business. I don't work for them. I've personally gone to them one time. But what happens is this particular group called Smart Choice MRI, they're located pretty much scattered around the city. They started up in Wisconsin. And no MRI is more than $600. You think, oh, you get what you pay for, right? Well, that's not always true. They're using the highest quality new GE technology. So they've got new machines, they've got brand new facilities, and they've got Cleveland Clinic radiologists reading the results. They make sure that they give you a disc, they make sure that they get the results over to your physicians. So you might want to take advantage of that. So anybody on that high deductible plan, if you don't want to tackle your deductible right up front, if that might be the only thing, maybe you sprained your ankle, you know, doing something, you're looking for something, and you don't expect any other expenses throughout the year, that might be something that could save you some money, whether you've got your traditional PPO deductible or this. So just a thought, just something, you know, some tips that we've picked up along the way. So virtual visits. So accessing care at the appropriate place is always really important. So now we have doctors and physicians, we have what we call convenience care clinics, then we have urgent care clinics that are affiliated with hospitals, and then of course obviously the emergency room. There's 4 different types, so it's really important to understand what they can and cannot do so that you access the appropriate facility that can do the right thing at the right time, and then, you know, gain you some money on the front end so that you have not spent too much. So going to an emergency room for something more simple like an ear infection might be overkill, might be expensive. So just knowing, you know, where to go might be an important thing to do. So, but there's one other opportunity that is newer. It's been introduced in the past few years, called virtual visits, or they call them telehealth, telemedicine. Those might be words that you're becoming more and more familiar with. That basically is accessing care through either a mobile app, just a telephone, or you know, through a laptop, computer, etc. That a physician can see you in a virtual setting, you know, through the camera system or just talking. They can, it's a lot less expensive than a traditional visit to your physician that could be anywhere from, you know, $85 to $165 for a pediatrician. These are, you know, roughly the copay, or maybe 40 bucks, you know, for someone who's on the high deductible health plan. So a lot less money if you're trying to be budget or cost conscious. You can speak to the, you know, an official doctor. They can go ahead and take care of many things, you know, such as cold, flus, you've got ear infection, allergies, you've gone on a business trip and you've forgotten your medication, they need to issue a new prescription in another location, they can do that. So one important thing, they also handle some mental health issues as well. So something that might be a more convenient solution to you at the appropriate time. So basically you're connecting, you know, on the mobile app, the video, you know, teleconference, etc. I put the email address there and the phone number, you know, interact with them. They can obviously send prescriptions. So just a thought. Other ways to save money. The $4 generic programs still exist. There's fewer and fewer locations out there that are doing it, but you still have Sam's Club, Walmart, Walgreens. There's 300 or 400 generic drugs that are $4, or, you know, for the 30-day supply, or basically, you know, $9 or $10 depending upon, you know, for the 90-day supply. They're loss leaders for these folks, so, you know, they're happy to have them on hand. And, you know, if you don't even, may not even want to run them through insurance because they're so inexpensive. So, you know, it's a cheaper option than paying your full, you know, maybe a $10 copay or something a little more expensive. So check with your pharmacy, see if they offer that program, and then know where you can head if you know, the time permits. I would recommend using OneRx as an application. It's a mobile app for your phone, and it helps identify, you've just been, you know, you've left the doctor's office, they've prescribed a medication for you, and you say, if I'm on the high deductible health plan, where am I going to get it the cheapest? So you plug in your number, your diagnosis, the milligrams, and, you know, is it tablet, is it this, capsules, and it'll show you, you know, your top pharmacies from nearest to farthest where it's the cheapest. So again, if you're looking for ways to save, this is one app that will do that for you. And there's no ads, it's not gonna, they're not trying to upsell you, they don't do anything. They're just promoting pricing, just like, you know, the gas apps, you know, gasoline for cars, you know, showing you where the best, you know, cheapest gas station to go to. That's what they're doing. So it's, it can be very helpful to some. And then one more program that you have available through Lincoln Financial is the Employee Assistance Program. So you can get help, you can get 4 in-person visits or unlimited support via their website or telephonically to clinicians for a number of reasons. So maybe you have depression, maybe you have some marriage or family issues, maybe you've got a parent that you might be dealing with an issue and you want to find the best, in-home facility for them. Maybe you need some, centers of excellence, recommendations, childcare, somebody who's already vetted, some of these locations. Anything that you can really think of as as far as, legal matters. You can get some additional assistance, and it comes in all languages and so forth. But it's private, and the important thing, it's confidential. Your employer's not going to know any reason why you're calling in. They don't get any of that information, so you don't have to worry about, who's going to know what. None of your coworkers are going to know. Strictly confidential. You can phone them, you can go online, you can get a wealth of information. They're a great resource for, a myriad of reasons. So basically, in a nutshell, it's just, giving you a couple ideas on how to become a better consumer, smarter about, saving, some of your money, keeping that in your pocket, reviewing your EOBs, obviously, taking, care of some of those preventive health visits that we all seem to put off. Just visit the Blue Cross website is, probably one of the most important things you could do for yourself. Register and just, kind of take a tour and see what they, what it might have for you. You're not going to take advantage of everything, but if you could take advantage of one little thing, maybe this year and so forth, it might just help. So I would just say stay engaged in your healthcare, and if you have any questions, you can get to me through HR. If you're, uncomfortable with, talking out some of those issues, but you need some additional support, you can call your Blue Cross people or get through to us. We're happy to help and to be there for you. Okay? And that's what I have. Thank you.